Inflammatory bowel disease or IBD. Most common medical myths. IBD is a condition that affects the gastrointestinal system. The symptoms often include abdominal cramps, bloating, constipation, and diarrhea. The symptoms can fluctuate and may last for days, weeks, or months at a time. In 2015, an estimated 3 million people in the United States had IBD. Globally, the disease affected an estimated 6.8 million people in 2017. The most common forms of IBD are Crohn's disease and ulcerative colitis. Both involve chronic inflammation of the digestive tract. Despite the relatively high prevalence of IBD, a great deal of misinformation and misunderstanding surrounds it. IBD is the same as IBS. IBD and irritable bowel syndrome or IBS both affect the digestive system and have similar acronyms. This perhaps explains some of the confusion. However, the two conditions are not the same. IBS is a disorder of the interaction between the gut and brain, leading to diarrhea, constipation, or both, along with bloating and pain. It can be worsened or precipitated by stress and anxiety. IBD is a disease of a dysregulated immune system, wherein the immune system starts attacking your own gastrointestinal system, leading to damage. The disease can lead to stress, worsening anxiety, depression, and loss of sleep because of the devastating consequences it can have on a person's daily functioning. Symptoms can include bleeding in stools, diarrhea, severe belly pain, unintentional weight loss, fevers, chills, rectal pain, fatigue, and more. Stress causes IBD. IBD is driven by the immune system, so stress is not the direct cause. It can make life very stressful. Stress can trigger IBD flares and exacerbate the symptoms in some people, which might help explain the confusion. However, stress does not cause IBD. IBD is linked to a personality type. Some small, decades-old studies have investigated the links between personality traits and IBD. However, whether there are any links between a person's character and IBD, there are none that we know about. Some people have both Crohn's and ulcerative colitis. Crohn's and ulcerative colitis are the most common forms of IBD. However, they are distinct conditions and people cannot have both. You can either have Crohn's disease or ulcerative colitis. However, in a very small subset of patients, it is hard to determine whether they have Crohn's or ulcerative colitis. The disease, however, does reveal itself over the course of a patient's lifetime. No treatments can relieve IBD. Thankfully, this is untrue. There are many treatments that are extremely effective for IBD. Depending on what you have and how severe the disease is, we have a plethora of options for medical treatment. Everyone with IBD needs surgery. No, everyone does not need surgery. However, with the advent of very effective and safe immunosuppressant medications, rates of surgery have dropped significantly over the past 20 years. According to Crohn's and Colitis UK, About 15% of people with ulcerative colitis will need surgery 10 years after diagnosis. However, in agri- however, the organization notes that the improved treatments available mean that this percentage is reducing. Early treatment with potent medications soon after diagnosis. This prevents damage, thereby removing the need for surgery. People should not take IBD medications during pregnancy. This is not true. Most IBD medications are very safe during pregnancy. The goal is to keep people with IBD in remission during pregnancy because the worst thing to happen for both baby and mother is for the disease to be active. There is an important exception, though methotrexate. That methotrexate is stopped even when women with IBD are planning to get pregnant. If your symptoms go, you can stop medication. Once drugs for IBD take effect and the symptoms disappear, it can be tempting to stop taking the medication. However, this is not what doctors recommend. Ending treatment can have serious consequences. For instance, the symptoms might come back, and if the person restarts on the same treatments, this may not work. A gluten-free diet cures IBD. A gluten-free diet works for people with celiac disease and non-celiac gluten sensitivity, but it will not benefit those with IBD. IBD only affects the gut. Although, as the name suggests, IBD significantly affects the bowel, the disease can also have ramifications on many other parts of the body. Apart from the gastrointestinal system, which includes the mouth to the anus, IBD can have extraintestinal manifestations like affecting the skin, eyes, and joints, to name a few. According to a review of extraintestinal manifestations of IBD, they can involve nearly any organ system and can cause a significant challenge to physicians managing IBD patients. For instance, IBD can affect the musculoskeletal system as well as the eyes, kidneys, and lungs. It may also damage the hepatopancreatobiliary system, which includes the pancreas, liver, gallbladder, and bile duct. IBD is curable. At this time, there is no cure for IBD. However, this is a work in progress. Researchers are working tirelessly to understand the condition better so that they can design better treatments and perhaps one day a cure. People with IBD cannot lead a normal life. This thankfully is a myth. They absolutely can. With proper medical management and sometimes surgeries, IBD patients can live a completely normal life.